Bismillah ar-Rahman ar-Rahim. Today's topic is the midline structures that's seen in the front of the neck. We'll go through the front of the neck and to show the midline structure there. We'll talk about the arrangement of that structures. What we have the as far above as the mandible, and we going downward till the manubrium sterni, which is part of the sternum, a bone of the thoracic cage. And you'll see that area is specialized for the passage of the alimentary tract, respiratory tract, and a lot of muscles and cartilage articulating together in aiding for the swallowing, for the respiration, as well as for the movement of the neck. Okay, we'll talk about in detail. First of all, we see that is the lower border of the mandible, the upper boundaries of that region, and as down as the manubrium sterni, which is a part of the sternum. In the front here, we'll find the hide bone, the thyroid cartilage, the thyroid gland, a lot of strap muscles stretched between these structures, as well as the ligament and membrane and the trachea. So let us see these structures. First of all, as we said, the lower part of the mandible, the symphysis menti, which is the meeting of the two mandible and the midline. Then comes the mylohyoid muscles that form the raphe, which is the union of the two mylohyoid muscles on the midline, as down as the body of the hyoid bone, and then comes the vessels, which are seen above the hyoid bone as the suprahyoid arteries, and those below the hyoid bones called the infrahyoid vessels. Then comes the membrane that connecting the hyoid bone to the thyroid cartilage, which is named as the thyroid membrane. Then comes the thyroid cartilage. If we saw the thyroid cartilage in the vertebral level, يعني في الباك, هنشوفها we are at the C4. So here that's the symphysis menti, that's the mylohyoid raphe, and that is the hyoid bone, and that's the thyroid cartilage, which is called Adam Abels in male, and that is the membrane, which is called thyroid membrane. Okay, here we are at the level of the C4. We continue and we reach this cartilage is named as cricoid cartilage. Between the cricoid cartilage, كلمة cricoid يعني ring shape شكله زي الخاتم. Cricoid cartilage and thyroid cartilage connecting by what's called the cricothyroid membrane, which are important in delivering the an emergency access for the respiration. Okay, then comes here another membrane that's connecting the cricoid cartilage to the trachea, which is called the cricotracheal membrane. It's going to be masked here in this region by what's called the isthmus of the thyroid gland. يكون البارت اللي في الميدلاين اسمه isthmus. Okay, so let's say that. So we name it the cricothyroid ligament, then the cricoid cartilage. الليفل متاعه هو at C6, يعني thyroid cartilage at C4, cricoid cartilage at 6th cervical vertebra. Then comes the cricotracheal membrane, the first tracheal ring. Then comes the isthmus of the thyroid gland. يعني الاسمس متاع thyroid gland يبدأ عند second to the fourth tracheal ring. يعني الفيرست tracheal ring بتكون باينة. Okay, in this region على الاسمس حنشوفوا anastomosis ما بين superior thyroid artery يعني على upper part of the isthmus أو superior border of the isthmus. We found the anastomosis between the two superior thyroid arteries. Okay, then comes the trachea, and then we reach to the what's called the jugular notch اللي هي عند sternum, just above the sternum. هنا حنشوف فيها artery اسمها thyroidia ema artery, يعني ema مفرد 1. That artery is going to supply the thyroid gland and comes from the arch of the aorta normal. Okay, and this artery is sometimes absent, so it is not usually there. Okay, so again, that's the raphe, that's the hyoid bone, that's the membrane, the thyroid cartilage, cricoid cartilage, the membrane. The first tracheal ring here should be here. That's the thyroid cartilage, the rest of the trachea, and finish with the sternal notch. Okay, here we found that some vessels here, that's one we already know that, which is the anterior jugular vein, which connecting the submental vein and below by the jugular notch. And that one vein is called the inferior thyroid vein, is coming from the thyroid gland to be drained into the brachiocephalic vein in the thorax. So we'll talk about that in detail when we talk about the thyroid gland. The thyroid gland, it's the largest endocrine gland, have no doubt, and this gland is so important because it's giving a lot of hormones, which is called the thyroid hormone T3 and T4, plus the calcitonin, which is for the awareness, for the metabolism. We know that if the gland has an hyperactivity, we name it as a hyperthyroidism, results in rising the heart rate, result high temperature, sweating, as well as the high blood pressure, hypertension. So at the inverse is going to be in the hypothyroidism, where the hoarseness of voice, the sleepy pattern, the fatty, moony face like this, as well as this gland could be have pathology like the malignancy, we name it as the adenoma, as well as adenocarcinoma, plus the autoimmune disease which causes the Hashimoto disease. So a lot of problems within the thyroid gland. The thyroid gland as the control of the pituitary gland by the thyroid stimulating hormone, and that level is going to be tested in case of the pathology of the gland. So the gland is the largest endocrine gland, about 25 grams, situated at that level. If we talk about the vertebrae, from the fifth cervical vertebrae till the T1. So the level from the C5 to the T1, the vertebral level. So it has an H shape with two loops and isthmus, as well as another loop, additional loop, is called the pyramidal loop, okay, which is projecting from the upper part of the isthmus upward. Okay, that loop is giving what's called the levator glandule thyroidea, which is a muscular band, fibromuscular band connecting the thyroid gland to the hide bone up to here. So that is going to be the gland is going to be moving while the hide bone moved with the swallowing and the movement of the respiration. Okay, so the loop is present in the second to the fourth tracheal rings, like this. Okay, that's the level of the two lateral lobes. So if we talk about in detail of the lobes, as we said, that it's going to be from the C5 to the T1, and it has a pyramidal shape connecting by what's called the isthmus of the thyroid gland. The loops reach it up to here, up to the cricoid cartilage, the thyroid cartilage as well, okay, and below is going to be reached to the fifth tracheal rings. So it's a little bit large, the loops, up to the third cartilage above till the fifth tracheal ring below. What are the superficial relation of the thyroid gland here? So as a gland is present in the midline like this, it's going to be covered by the skin, the superficial fascia of the neck containing the platysma muscles, the muscle of the facial expression, and comes usually the investing, as usual, the investing part of the deep fascia that's covering the roof of the front of the neck. Then comes the strap muscles that's connecting the sternum to the hide bone, the sternum to the thyroid cartilage, which is named as sternothyroid, and below thyrohyoid, and another one which is called the omohyoid, that is passing to the scapula, the omohyoid, either superior pili and that one is the inferior berry. What are the structures seen behind the gland if we look behind the gland? We'll find the carotid sheath here, where the carotid sheath is containing the common carotid artery, internal jugular vein laterally, and the in between the vagus nerve. Also, behind the gland, we have the 4 pins-like sized gland, which is named as a parathyroid gland. The inferior thyroid artery is going to pass behind the gland like this, as well as the superior thyroid artery is going to divide into 2 branches, anterior branch and posterior branch. The posterior branch of the superior thyroid artery is going to meet the inferior thyroid artery in the back of the gland. Medially, here, what are structures seen in the midline? We have 2 cartilage, 2 muscles, 2 tubes, 2 nerves. The 2 cartilage are the larynx, that is the thyroid cartilage and the cricoid cartilage. 2 muscles, which are the cricothyroid, that muscle, cricothyroid, the muscle stretching between the 2 cartilage, and another muscle which is called the inferior constrictors that comes to here, inferior constrictors. And 2 tubes will be the trachea and the esophagus below. So the larynx is going to be continue as the trachea, and the pharynx is going to be continue as the esophagus. Then we have 2 nerves here, which is the external laryngeal nerve. That nerve is coming down like this, and another nerve which return back like this. So those 2 nerves are the laryngeal nerves, external and recurrent laryngeal nerve. Let's see in the sagittal section how this relation appear. The red one is going to be the loops, and what we're seeing behind is the medial surface. So as we said, we have that muscle, that's the cricothyroid, and the big one here is the inferior constrictors of the pharynx, the 2 tube below. The pharynx is going to be the esophagus, and the trachea is, the larynx is going to be the trachea. The nerve which comes here is the external laryngeal nerve with the superior thyroid artery, and the recurrent laryngeal nerve with the inferior thyroid artery. So those are the structures are so important to know. Next is the isthmus, which is this part that is related upward here to the anterior branch of the superior thyroid artery that are going to be meeting its fellow, on the other side, just above the gland, like here. That's the upper border. While the lower border is going to be the inferior thyroid vein, زي ما قلنا اللي هو بينزل is going to join the brachiocephalic والثيرويديما، الحاجات اللي قلنا عليهم في بداية المحاضرة at the structures in the midline. Loops of, the isthmus is going to be related to the second, third, mainly second and third tracheal rings, okay, so it's not too big. The anterior surface is going to be covered by the same relation of the thyroid gland. So another thing here to know that the gland has a 2 capsule, in fact, has a true capsule which is enclosing the gland completely, and that's derived from the investing layer. Another which is another false capsule that's derived from the pretracheal fascia. So we have 2 capsules, one is true and one is false. Remember that the vessels of the gland, like the superior thyroid artery, the inferior thyroid artery, and so on, is going to pass between those 2 capsules. Okay, that's the gland. Okay, and how the that is the investing layer, how is closing the gland. Okay, and the one which is just like this, that's the trachea. Okay, so one of them is going to be the pretracheal, the blue one is going to be the pretracheal fascia. Okay, so we we care for the investing capsule more, which is named as the true one. Okay, so هذا ملخص للريليشن of the gland لما قلنا في lateral surface، يعني في الفرونت كي برا. those are the muscles اللي هم sternothyroid, sternohyoid and the omohyoid, وتغطى كلهم ب sternomastoid. behind هنا حيكون اللي هم الكاروتيد شيث والمحتويات متاعها. medially حيكون زي ما قلنا two cartilage, two nerve, two vein, two tubes and two nerves. Let us see what are the blood supply. احنا خدينا already فكرة عليه, but let us see the blood supply of the thyroid gland. As we said here, that artery comes from above is called the superior thyroid artery. The one which comes from below is called the inferior thyroid artery. And two artery entry veins, superior thyroid vein, middle thyroid vein, as well as the inferior thyroid vein. Okay, let's see them. The first one, which is the superior thyroid artery, is a branch from the external carotid artery, as we said. It's going to pass downward and medially ويخش بين كيف ما قلنا بين two capsules to reach the gland. يهمني which nerve is accompanying that artery is the external laryngeal nerve, which is an important nerve to supplying the muscles of the gland and sensory supply as well. So the superior thyroid artery is going to supply. هل حيكون supply لللوبس بالكامل ولا يقسم بينه وبين inferior thyroid? No. بالنسبة لللوب is going to supply only the upper 1/3. يعني ال upper 2/3 هي supply by the inferior thyroid artery. Okay, but while the isthmus is going to be divided equally, يعني the upper half the superior thyroid artery وال lower half is going to be supplied by the inferior one. Okay, زي ما قلنا superior thyroid artery is going to anastomosis with the other side contralateral superior thyroid artery just above the isthmus. That's the superior thyroid artery, how it's divided into anterior branch and posterior branch. Anterior branch يمشي يدير anastomosis مع anterior branch بتاع superior thyroid artery of the other side. أما posterior branch is going to pass backward as a relation of the thyroid gland and is going to be anastomosis with the inferior thyroid artery. What are the branches? يهمني طبعا إنه يعطي branch اسمه infrahyoid artery لأن حناخده بعدين artery ثالث آخر اسمه suprahyoid artery, so we care for the infrahyoid artery, as well as the glandular branch زي ما فهمنا is going to be supply partially the lobes and partially the isthmus. The infrathyroid artery is a branch of the thyrocervical trunk, which is a branch from the first part of the subclavian artery. That's the first part of the subclavian artery, and that's the thyrocervical trunk that giving three arteries. One of them is the inferior thyroid artery that passing upward to reach the back of the gland to supply the lower 2/3 of the lobes as well as the lower half of the isthmus. Okay, this turn is at the level of the thyroid cricoid cartilage. I mean at the level of the C6 thick cervical vertebra. Yes, like this. And what are the branches giving is going to supply the larynx part, lower part of the larynx, trachea, and the esophagus. The third one, it's called as the thyroidema, that could be absent, arising sometimes from the innominate artery, brachiocephalic artery, or sometimes from the arch of the aorta. Ascending upward like this is going to supply the isthmus of the gland and could be absent. طيب هنا عندنا نقطة بنتكلم عليها اللي هو in case of the a problem, as we said in the first in the lecture, that is the thyroid gland could be have a problem, either pathology, tumor, infection, so may necessitate its removal, which is called the thyroidectomy. يعني نشيلوا استئصال الجلاند. In this case, طبعا as usual principally in all surgery, if we are going to remove part of the body, we have firstly stop its blood supply before عشان ما يصير شنو profuse bleeding. طيب لما نحول الثايرويد gland we have to ligate, stop the superior thyroid artery as well as the inferior thyroid artery. طيب what's the problem? The problem that in the superior thyroid artery is accompanied by the external laryngeal nerve, and the inferior thyroid artery is accompanied by the recurrent laryngeal nerve. So what's the key? طيب. So during thyroidectomy, the surgical excision of the thyroid glands, either totally or partially, we have to ligate the superior thyroid artery. Okay, so the thyroid end should be ligated, يرتبط, as close as possible to the gland. ليش؟ لأن هو ماشي معاه الاكسترنال laryngeal nerve، وهم ماشيين ومن طلعتهم يقعدوا ماشيين مع بعضهم. they are very close، يعني يمشوا بالشكل هذا very close. اوكي، لما يوصلوا الجلاند يتباعدوا من بعض. اوكي، يمشي النيرف في جهة والارتري في جهة. so in this case we can ligate simply the artery. لو ربطناها هنا ممكن نديروا injury to the external laryngeal nerve والpatient in the high pitched voice. اوكي، لو درنا لقيش باهي بالنسبة للانفيريور thyroid artery هنا العكس. اوكي، two arteries يجوا very far away from each other وبعدين يمشوا مع بعض like this. Pardon. We have to ligate the artery, I mean here. Okay, that one was here as close to the gland here. Okay, so هنا as far from the gland لأن شنو؟ لأن بيكونوا لما يوصلوا للجلاند بيكونوا شنو؟ بيكونوا very close to the nerve. ولو نحن درنا cut أو injury للrecurrent laryngeal nerve end up with hoarseness of voice، بحة في الصوت. ولو كانت bilaterally يعني لسوء الحظ حيصير عندنا stridors و loss of the voice completely. Okay, so that's important to know as applied anatomy of the thyroid gland. So what about the venous range? As we said, there's two important artery and one plus minus artery. Here we have three veins. The superior one is going to be drawing the apex، يعني قسموها إلى ثلاثة أتلاف. Upper third is going to be drained by the superior thyroid vein, end up in the internal jugular vein. The same is true for the middle one, and while the inferior one is going to end into the brachiocephalic vein, mainly the left one. Okay, so that is the venous range of the gland. Lymphatically, the gland is drained into many groups, either prelaryngeal, pretracheal, paratracheal. Okay, طيب كلهم حيمشوا يديروا شنو drained وين؟ في الأبر وفي الأبر واللور deep cervical اللي هي نسميها نحن omodogastric groups of lymph node, and some of them is going to be drained into them. Okay, بمعنى آخر إن المجموعة هذه هي البريتريكل والبريلارنجل والباراتريكل حيديروا درينج لشنو؟ درينج لللوبس. أما الإسمس حيدير درينج مش حيمشي في البريتريكل، حيمشي مباشرة وين؟ إلى الميديستاينم، مش في النك، في الميديستاينم. Remember that please. Yes, enlargement of the thyroid gland as in this lady is called the goiter, which is sometimes painless, sometimes symptomless، يعني عبارة عن انتفاخ بدون أي symptoms، بدون أي clinical implications. So unless the patient have an ugly appearance of the neck, and neck is going to be removed for the surgical for the aesthetic purpose. طيب either increase the enlargement of the goiter like this could compress the trachea and the esophagus ويسبب شنو؟ asphyxia as well as the dysphagia، يعني صعوبة في البلع وفي التنفس. Remember that anatomically the thyroid gland could be enlarged in many directions, laterally like this, and inferiorly like this, but could not extend it superiorly because of the attachment of that muscle here, which is the sternothyroid muscle that comes from the sternum to the thyroid. So it's to prevent the enlargement or limit the enlargement superiorly. Nerve supply is going to be supplied sympathetically by the sympathetic chain. The parathyroid gland here, we have four parathyroid glands to right and to left. It's going to be supplied by the same blood supply of thyroid gland. the trachea. It's it's part in the surface, I mean in the neck, and part in the thorax. And it's the continuation of the larynx at the level of the C6. يعني C6 هذا هو level of the بداية التراكيا، بداية الاسوفيجاس وكذا. تنتهي عند التي 4 طبعا ب divides into bronchi طولها حوالي 10 سنتيمتر. النهاية متاعها اسمها كارينا. more sensitive الكف والني يصير دائما وين في البايفوركيشن أو في الكارينا. what's called the carina here. Okay, what's that? So if we have a problem here, we have to fit the structure in the way above, so we have to make what's called a clinical. We cut the skin like this vertically, comes to the superficial fascia, and what is like this, come to the strap muscles, so the sternum, we cutting them vertically like this. Okay, at this level, which is the level of the isthmus. We cut the isthmus of the third hand to reach the area here. Then we find the trachea. Now we are going to find the trachea, but in horizontal like this, to open the trachea and to insert what's called the airway directly into the trachea to get or to assure the respiration. Okay, that's what's called the tracheostomy. This is done at the hospital with an expert person, I mean in the ICU. This is a permanent, and actually the last research tell that it doesn't improve the mortality, but it always done in case of the emergency. Okay, what's that? That's the relation of the trachea. And then the esophagus. The esophagus is going to be the same beginning, and about it's very long, about 25 centimeter up to here. Then you land when you land stomach to enter into the stomach. Okay, so that's the esophagus. Okay, by this we finish the midline structures in the neck, and have a nice day. Thank you.